Hi, thanks for watching today's video. I'm Brian, the Finance Ninja. I don't want to waste your time, so let's get to it. Today, we're talking about the campaign to force Palantir out of Britain's National Health Service. This disinformation could severely hurt Palantir in their future contracts. So this is very important. Their argument comes to the core of a misunderstanding of what Palantir does. So to counter it, I will talk about their argument, details of the deal, why their argument is dangerous for people's lives and for Palantir shareholders, the possible domino effect this disinformation can cause, what exactly Palantir does, I will counter their argument, what I expect to happen, and what I will do in response to this. So let's start with their argument. The NHS is being sued by a group of people to get Palantir's contract with the NHS revoked. The campaign is called No Palantir in Our NHS. I'm not joking. It was started after Palantir partnered with the NHS on an issue data store. It says that Foxglove, which describes itself as a tech justice nonprofit, is leading the campaign while over 50 other organizations working on civil liberties, anti-racism, microjustice, and public health have also backed it. What they don't understand is civil liberties, racism, and microjustice have nothing at all to do with Palantir's contract with the NHS. This is fear-mongering. This is FUD. I will get into that in a bit. Clive Lewis claims that Palantir has a questionable agenda and thinks minorities will feel a threat. How? From where? He doesn't explain. Clive shows here that he has no idea what Palantir does or how it operates. Foundry does not contain any personally identifiable information, which I'll get to in a second. Also, this data is stored on the NHS's internal network. Palantir does not store any of this information on any Palantir network. And the article claims some FUD at the bottom when it implies that Palantir contains everybody's health data. It does not contain any PII. This article lied. Bad on you, CNBC. I do not think anybody who uses the term whiz-bang has any technical knowledge. Like, at all. Actually, good one here on CNBC. Here's what Palantir has access to and why these lawsuits are doomed to fail, in my opinion. Patient data is pseudonymized before it is processed by Palantir software as part of an effort to protect patient privacy. The data management technique involves switching the original dataset with an alias or pseudonym. So what exactly is the threat here? I don't understand. They make no sense. Like I said, Palantir software contains no personally identifiable information at all. It is used to track the issue, organize the response, manage supplies, and save lives. That is all. The article goes on to say that the alias system is reversible. It does not state that only somebody at the NHS would be able to do this. If something like this happens, then an NHS employee is breaking the rules, not Palantir. The rules would have been broken with or without Palantir. Palantir has nothing to do with the NHS employees reversing the data. It is on the NHS and the NHS only. If something like this were to happen, then blame the NHS and the NHS only, because only they could have done it. Let's continue. The article states that while Palantir is processing the scrubbed patient data, the NHS remains the data owner, limiting what Palantir can do with it. This right here kills the suits, in my opinion. Not only does Palantir not store the data, it doesn't even get the real data in the first place. I pulled this from the group's event notes. A little xenophobic, anyone? Let's continue. Next segment. Details on the deal. I already discussed part of this in the previous segment, so I can keep this short. Palantir got a £23 million deal to work with the NHS to save lives due to the issue. Foundry was implemented in March 2020 and is set to run until December 2022. It was established to manage the data to inform the government's response to the issue. This details the Trojan horse effect I noted in my previous video. You can view that video by clicking the link up above. In that video, I explained how Palantir will install its software as a trial basis for free, and then up the terms upon renegotiation. Look here, initial setup fee, £1. £1! Extension, £1 million. It states that when a supplier is chosen, likely Palantir because it's already been installed, why switch? The contract will turn into an £18 million a year for 5 years, totaling almost £1,100,000 by completion. Trojan horse effect. Here's details on how the data store works. This will ensure that data can be used by the NHS and government to look at trends to monitor the spread of the issue and implement measures to ensure services and support is available to patients. For example, the data can be used to look at bed capacity in hospitals or the number of ventilators available in a particular area. This saves lives. Clive wants to dismantle this. Why? It's because he doesn't understand what Palantir does. Nothing else. He thinks he's well-meaning, but his actions will result in the death of people. It's unfortunate and it is sad. Here's information on all the organizations involved in saving lives. You have faculty, McKinsey, Deloitte's, Ann's Group, and Palantir. Hey, Palantir got singled out. Let's see who can access the data. A public information dashboard showing statistics on cases of the issue and deaths associated with it in the UK, updated daily. A strategic decision makers dashboard providing a national summary of situation report information alongside modeling, simulations, and analysis. These dashboards are designed to help senior national and regional officials to make policy and strategic decisions in response to the issue. Only government and senior regional analysts and managers are given access to this dashboard. An NHS operational dashboard providing local NHS and local government organizations with a clear picture of what is happening both across the country and specifically in their area so that they can take the right local action. I don't see anybody at Palantir listed. Do you? Now let's talk about why their argument is dangerous. This is easy. If Palantir gets removed, the government's response will become muted and people will die. Next, the possible domino effect of disinformation. As we've seen in other cases surrounding the issue, especially with all it takes is a little disinformation to cause a domino effect. This domino effect will build upon itself, and in the end, people will suffer if they win the case. It is extremely sad that people can become this misinformed to such a dangerous level. So next segment, what does Palantir do? Already covered it. Next. Next is to counter their argument. And done. Next. What do I expect to happen? With court cases, it is hard to say, but in the end, I expect reason to prevail. And now the ultimate question. What will I do in response to this? If the stock sells off, I will purchase more shares. In the meantime, though, I'm just holding. Tell you what, since you made it this far, I will give you a hint for my next video. It will be an updated version of my Tesla Robotaxi valuation model. I expect it to release in 2 days at 12 o'clock noon Pacific time. Make sure you click the notification bell so you don't miss it. So let me know in the comments below, what do you make of all this? Will this thank Palantir in the NHS? Don't forget to smash that like button and subscribe. Thank you for watching, and I will see you in the next one.